Cancer Awareness Month. And why just breast cancer? Why not any other cancer? We'll talk about it because see, the moment we talk about cancer, जैसे ये शब्द cancer दिमाग में आता है, the first thing that everybody thinks is end of life. It's like probably this is a disease which is not curable. But be rest assured that we are not living in the 1900s where the treatment is not available, where cancer only means end of life. Because nowadays we have a lot of good treatment modalities for cancer. But why just breast cancer? Because breast cancer has become the most common cancer all over the world. Not only if we talk about women, definitely in women, breast cancer is the most common. But overall, also, if we talk, the number of cancers in breast is the maximum compared to the rest of the organs of the body. So simple language में अगर हम पूछे कि what is cancer, when I ask anybody what is cancer, they just think that it's some kind of a germ which is going in the blood. So basically क्या होता है कि there are these small cells in our body that makes our nose, our ear the way it is. Sometimes when these the formation of an extra growing thing which becomes like a tumor. Like I said, breast cancer is the most common cancer worldwide in the women right now. And we are talking about this awareness because this is one of the cancers which has a high cure rate, which has a very high survival rate. But that is only possible if it is detected at an early stage. So early stage में detect करने के लिए क्या करना चाहिए? A lot of patients come and ask me that is there any test that we can do prior, not just for breast cancer but for any other cancer. So there are multiple things that we can do to detect breast cancer at an early stage. So initially, cervical cancer was the most common among the women. But due to the cervical cancer vaccines, the cervical cancer has gone down and breast cancer has gone up. So another thing is that most of the people think that breast cancer is only a disease of the women. It's not a disease of the men because men obviously they don't have breast as an organ. But it is seen in men as well. Around 1 to 2% of incidence is seen in men. Though men does not have proper breast tissues, but they have a chest wall which has breast fat, which is very prone to breast cancer. Not as common as in women, but yes, 1 to 2% of the men in the entire world also have breast cancer. So anytime if a male किसी पुरुष को अगर कोई lump वहां पे feel हो रहा है, so please don't ignore. Don't think that this is something which is embarrassing, that this is a disease of the female which I have it, and don't ignore it. Please go to the doctor. So this is some data which I'm just sharing that one of 8 individual will have cancer, which was a Globocon data in 2020. And in women, breast cancer is the most common cancer followed by cervical cancer. So if we talk about just breast cancer, so yes, India is facing a very challenging situation. Around 13.5% of all the cancers was breast cancer. So you can imagine if there are 100 types of cancers, उसमें only 13 to 14 is breast cancer. So that's a lot of big number because we have from top to bottom. There is head and neck, there is stomach, there is lungs. Usme bhi 13.5% is being taken up by breast. That means it's extremely common. Out of which 10.6% accounted of all the deaths in breast cancer. Though breast cancer is very curable, it has an excellent survival rate, but still 10.6% still had deaths. So initially it was felt that it is mainly a disease of the postmenopausal age, which is more than 40 years. But we are seeing that this trend is changing and it is going more towards a younger population. Now, why is we having so much mortality? Why is the number of deaths with breast cancer so high? That is A, because of inadequate screening. Like the Western population, like the UK and US, India does not have a generalized government protocol or screening, which can be done beyond some age. Secondly, it is diagnosed at an advanced age. So what happens? Females have this habit of delaying everything. So if you go to any household home, suppose your mother or your wife has a breast lump, it has been seen by an ICMR study that they take around an average of 271 days to even disclose it to their near and dear ones. So imagine 261 days is almost a year. She takes 261 days to tell her near ones because I think she thinks that if in case it comes out to be cancer, it's a prolonged treatment, there's a financial burden. Plus, who is going to take care of my family? So most of the time, the females they avoid going to their relative and they avoid going to the doctor. Secondly, there is unavailability of appropriate medical facilities. So though all of us are living in a metro city where instantly we can get a super specialist and we can go to a doctor and we can get it checked. But the moment you go a little in the suburban areas, there is a lot of difficulty in finding appropriate medical facilities. So these are some common reasons why we find breast cancer at a higher stage.
से मत बोलो, काम पूजा है, काम को पूजा की तरह करके करो.
Madam, just I am muting.
So if you ask us कि क्यों हो रहा है इतना cancer, why is it increasing? So there are some factors which is modifiable, जिसको हम लोग change कर सकते हैं. Some factors which are non-modifiable. Like some things that we can't change is our gender, our age, our ethnicity. And somebody who has a family history and possesses a gene can't be changed. But some things that can be changed is a sedentary lifestyle, alcohol consumption, tobacco consumption, use of oral contraceptive pills.
Madam, the slide is not visible right now.
अरे ठेव ना, काय करतो तू? ठेव लवकर, लॉक कर ना ते.
Sorry.
The slide is not visible right now.
मुझ में it's visible. नहीं तुम्हें? Can you see now?
No, ma'am.
What
No,
do you
sir,
want?
visible है. मैम का स्क्रीन विजिबल है.
Yes. ठीक है. Okay.
So those are some non-modifiable risk factors and some modifiable. अगर आप मुझसे पूछोगे कि how will we know कि it is a breast cancer का symptoms? So one of the symptoms, the most common symptom of breast cancer is a lump. आपको breast में एक lump, कोई एक गांठ जैसी feel होगी, which can feel like a peanut to an almond, to in fact even जो लोग बहुत ignore करते हैं, to the size of an orange. Any change in the size of the breast, which can be a swelling, redness, rash, any discharge from the nipple, which can be milky, liquidy, or maybe bloody. Any kind of pain, tenderness, any rashes can be a sign of breast cancer. The most important thing is breast cancer goes to your underarms. So if you're finding a lump in the underarms, that's a very, very important thing to be noted. Don't ignore a lump that is there in your underarms. Another one of the thing is कि most of our patients come to us saying that we came to you at a later stage because pain हमें नहीं हो रहा था, pain मुझे अब हो रहा है. So 95 to 99% of the lumps at an initial stage is all painless. Don't wait for the pain to come. The pain comes only once the cancer has advanced to another stage. If we talk कि हम लोग breast cancer diagnose कैसे करते हैं, so the most common is clinical, जो हम लोग हाथ से check करके देखते हैं whether there's a lump or not. कुछ tests we get it done like a mammogram, MRI, USG, PET scan, depending on the type of lump you have. And if required, if the lump we suspect could be cancer, we go for a tissue biopsy. Now, there are some myths about biopsies. A lot of patients, they don't want to get a biopsy done because they think biopsy karane se it spreads to other parts of the bodies. But please be rest assured, it's a myth. The word is a myth. It is a word. It's a myth. Do not think that biopsy कराने से cancer शरीर में कहीं और फैल जाता है, because if you don't get a biopsy done, you will not get a diagnosis. Breast cancer itself is around 10 to 15 types. Only a biopsy can tell you which type of breast cancer you have, and only then you can have a proper tailored treatment. So if we talk about treatments, there are a lot of modalities of treatment, but if we bifurcate it into major headings, so the most important treatment is surgery. Those who fall under stage 1, 2, 3, they undergo surgery. There's chemotherapy, radiotherapy, and hormone therapy. Hormone therapy is in the form of a tablet, and there are new modalities like targeted therapy and immunotherapy. So all patients are not eligible for all the modalities, but those patients who have all the modalities under their treatment, somewhere around 9 to 15 months are required to complete their treatment. Now, if we talk about surgery in perspective, so there are two types of surgeries most commonly done, which is mastectomy, which is removal of breast, versus the breast conserving surgery, where we conserve the breast. So there's a myth revolving around this that a lot of patients feel कि अगर breast को हटा दिया तो cancer वापस नहीं आएगा. But nowadays things have completely changed. There are some landmark trials that have proven that आप breast बचाओ कि आप breast नहीं बचाओ, the recurrence is same and the overall survival is same. So there is no added benefit if you get the breast removed. In fact, the new trial says कि अगर आप breast बचा के कर So again, what I just said is mastectomy required for all. So no, it's a stigma, it's a social issue. डॉक्टर से ज्यादा रिलेटिव्स है जो आपका दिमाग खराब कर देंगे बोल के कि नहीं 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 गेट द ब्रेस्ट रिमूव्ड. इवन इफ द डॉक्टर इज सेइंग सेव इट, द relatives will tell you to remove it. Mastectomy is not required for all. Even if there are कोई लोग होते हैं जिनके will file 5 to 6 tumors in a breast, or the tumor is too big to save the breast. So in that case, there are a lot of multiple reconstructions options which is possible, so we can use your own body fat, we can use your own body muscle to reconstruct. And also we can use an outside implant, which is a silicone based implant, to reconstruct the breasts. So the most important thing is there is no alternative medicine. So the moment you have a breast lump, please don't go to any alternative medicine, because at present we don't have a treatment in alternative medicine. Maybe in future, if we have it, we should definitely go for it. But if you have a breast lump, please go to the right doctor, get it checked properly. Again, my main concern is go to the right doctor. Don't roam around everywhere. If you see in today's world, you have even one cornea specialist, even in an eye, you have a retina specialist, you have a cornea specialist. So from top to bottom, you'll find every organ specialist. And we are lucky that we are in Kolkata, in a metro city, where we get an appointment maybe almost the next day. So please make use of it and go to the right doctor. There are some myths that revolves around breast cancer. One, I already mentioned, that biopsies do not cause spread of cancer. Only women with family history has breast cancer. Things have changed. There are a lot of mutations happening in the environment due to radiation, due to lifestyle changes, that is causing breast cancer. And all breast lumps are not cancerous. So ऐसा नहीं है कि आपको कोई भी breast lump हो गया तो now you are scared कि आपको cancer है. Usually in the younger population, 15 to 25 years of age, there are some lumps which is called as fibroadenomas, which are non-cancerous. So they are absolutely non-cancerous. There's nothing to worry about it. Again, men can also get affected. And lump is not the only symptom. Like I mentioned, there are multiple symptoms. There are few myths that people think that mammogram causes cancer. But mammogram has very, very limited radiation. It's somewhere around 0.4 radiation, jo gray hum kehte, it is that. So that doesn't cause cancer. So you can please go ahead and get your screening mammograms done. If we talk about stages of breast cancer, it is divided into 1, 2, 3, 4. One is when it is very localized and the survival rates are excellent, more than 98%. And stage 4 is when the breast cancer is spread to the different parts of body. And obviously the survival goes down, and it is around 16% in 5 years. So advanced stage has obviously low survival. The more important thing is in India, it's quite unfortunate, but 60% is diagnosed after the age of stage 3 and 4. So that is quite shocking, because now awareness is quite increasing, but stage 3 and 4 tak aate even the doctors can't do much. In fact, these are the reported data that we have. I would say in India, we have a lot of unreported data which has still not been reported to the government authorities. So what should we do as individuals? हम जो ये बातें कर रहे हैं, this is a webinar. What should we do as prevention? We can do a cell breast examination. We can do a clinical breast examination, and we can do some screening tests. जो हमारे हाथ में, some things which is not in our hand is that we've got cancer. But some things that we can do is we can catch it at an early stage. So how do we do a cell breast examination? So cell breast examination, every woman should undergo. When they should undergo, they should go at 8th to 9th day of periods. They should undergo a cell breast examination. What they should look at both the breasts. Every month they should do it. So see how your breast looks. Anytime you think there's something which is not right, can be a sign of breast cancer. Look unusual. If there's an increase in size, there's some retraction, there's some redness, there's some puckering, any discharge that is coming. With your hand on the sides, hand above and hand next to your waist. Use the pad of your fingers and use fashion. With the right hand, check your left breast. With the left hand, check your right breast. After you've checked it in front of the mirror, check it while you're taking. Then I can also check it whether you have any lump or not. Always remember to check your underarms, because your underarms might have a lump which gets missed, and sometimes you don't have a lump in the breast, but you have a lump in the underarms. So these are all something that you can find it on cell breast examination. In case you have something suspicious on your cell breast examination, please consult a doctor. Even if you find nothing on cell breast examination after the age of 40, please go for a screening mammogram. So what's a screening mammogram? So what happens? It picks up very small tumors. So this tumor that you can see, that white circle, it's actually a 5 mm, which is half a centimeter of the tumor, which can't be felt, but can only be seen on mammogram. In fact, mammogram picks up breast cancer years before a breast lump can be felt. So, that's how powerful a screening mammogram is. So please don't be lazy. Go to the nearest diagnostic center and get a screening mammogram done if you're more than 40 years of age. What else can you do? This is something that you can check whether you have cancer or not, but something that you can always do to prevent cancer completely. What you can do? Reduce the extra weight. If you're obese, if you think you're overweight, Please exercise. It has been seen that exercise reduces the chance of breast cancer by 15 to 20%. And somebody who already has breast cancer, it reduces the recurrence by around 20 to 25%. Then में 24 hours होते हैं, उसमें 30 minutes you can give to yourself and you can exercise. Don't exercise 7 days a week, but at least you can exercise 5 days a week. So the norm is 30 minutes per day for 5 days per week. Have a balanced diet. I understand that it's easier for us nowadays to open an app and order food immediately. Those who are not living with family, it's even easier for them. But please have a balanced diet. I'm not saying don't enjoy life, don't order food, but have a balanced diet. कभी बाहर से order कर लिया तो कभी घर का भी खा लिया. So have a very good balanced diet, because nowadays, because of our dietary changes also, there are some mutations happening that can lead to breast cancer. So there are some studies that have shown that patients females who don't breastfeed have a higher chance of breast cancer. But this does not mean that any female who has not breastfed will have breast cancer. It just has a little higher chance. Thirdly, please avoid alcohol. I would not say completely stop it, but moderate it. If you're having every day, then you can moderate it to maybe once or twice per week. So that is it. So how will early detection help us? Itna jo we are talking about early detection. So if we if we do all these cell breast examinations, screening mammograms, and if we find the breast cancer at an early stage, what we can do is maybe you will not require all the modalities of treatment. In fact, 90% of the patients with stage 1 breast cancer, they do not require chemotherapy. You need not get your breast removed. Breast conservation surgery is also possible. And your survival is more than 99%. Survival rates are extremely high. So maybe you'll just have 4-5 months of discomfort while getting the treatment, but after that, the life is exactly the same. So this is something I wanted to tell, that, this breast cancer is not just the patient's disease, it's actually a family's disease. October is the breast cancer awareness month. All of us have to come together and we have to spread this awareness. We have to tell our family that in case they find something, they have to come up and they have to get it tested. We have every modality, everything available globally here in Kolkata. You want a genetic testing done, all the recent tests, all the genomic tests are being done. It is just that they have to come to us at an early stage. So that is it. Thank you so much. It is not something that one can do alone. A patient needs the support of everybody. So this is something I feel it has to be done by a group, and it is not something which only one person can do. So thank you. Any questions, please feel free to ask. And somebody who wants to ask me something personally, I think Pranabesh can share my number. You can WhatsApp me. Thank you, sir. Thank you, Dr. Banerjee.
Thank you, madam. My request to audience, in case of any question, if it is very much private, I will share madam's WhatsApp number and they will reach. Okay, ma'am. Thank you so very much.
You can ask now also if anybody has any questions.
As in overall in general.
Yeah.
Madam, actually, my question is in case of female, the examination we have seen. But what about the male's examination?
It's the same. It's the same.
Okay. Okay. And any precaution for both? Exercise. Weight reduce.
Yes. Doesn't mean you'll become malnourished, but just a healthy exercise. At least 30 minutes per day. That much we can give our lives.
Thank you so very much, madam.
Thank you.
I think no question from audience right now. Okay, ma'am. Thank you so very much.
Thank you. I leave
No, ma'am.
Hi, doctor. Myself Ashwini here.
Yeah, hi.
We have a question, two questions. One is that how can we, avoid to, what to say, this breast cancers, the garments, what we are wearing it. So what kind of garments need to select? Is that cloths are any, this one is there, what to say?
No, not at all. Not at all. It does not cause breast cancer. You can wear whatever.
No, doctor, I didn't hear. I think there was some network issue.
I'm saying I'm saying what type you want, whatever size you want, nothing, all this doesn't cause breast cancer.
Your voice is not audible, doctor. I'm so sorry.
No, Ashwini, she's saying you can wear any material, any kind of clothes. It will not cause breast cancer. You can wear
Okay.
any size or any material. There is no problem.
Okay, okay, fine.
Is it
Thank
clear
you,
now?
doctor.
Any type, yeah. Wired, no wired, you can wear whatever.
Any question from our audience side? कोई बात नहीं मैडम, मैं आपका व्हाट्सएप नंबर शेयर कर दूंगा ईमेल में।
Okay, sure.
इसके
sure.
बाद किसी का कोई भी कुछ क्वेरी रहता है, कोई एडवाइस रहता है तो दे विल रीच यू। ओके
Sure, sure. Okay.
Okay.
Thank you so much.
थैंक यू।
Thank you.
And मैंने
Thank you,
तो
doctor.
बोलना ही भूल
Take
गया,
care. Have a good day.
पोस्ट दुर्गा पूजा
Thank you.
हम लोग मीट कर रहे हैं, शुभ विजया सबको बोलना भूल गया।
Shubho Vijay.
Thank you.
ठीक है, ओके,
Bye bye.
थैंक यू, बाय बाय।